Okay, we're continuing with this book here, Prevent and Reverse Dental Disease by me, Pete Rogers. You know, how to number the teeth. Well, first of all, how to name the teeth. The teeth right in the center are called incisors, to sort of bite into the food. The next one is called the canines. There's a tiny little point on them, but it's close to flat. We have teeth like a herbivore, like a horse. Look up a horse's teeth, look at your own teeth in the mirror. You know, you barely can tell the difference. Then the bicuspid or premolars, and then the molar teeth, okay? And our jaw can go side to side for grinding plant foods. We have 32 teeth. Here's how you count them. You go in a clockwise direction. Begin with the right upper tooth, right upper posterior tooth, you know, the third maxillary molar. So here'd be how we do it, okay? You want to start on the right side all the way and back. That'll be tooth number 1, the far posterior upper molar. The upper part of the jawbone is the maxilla. The lower part of the jawbone is the mandible. Okay, so you go 1, 2, 3, 4, 5, 6, 7, 8. There's 4 quadrants, so 8 all together. All the way down to 16 here. Then you would drop down, and then this first one would be 17. Then go all the way to get to 32 over here. That's how you count the numbers of the teeth. So these are the incisors right in there. Then the canines. Incisors, canines, then the premolars, then the molars in the back, or you can call these the bicuspids. Okay, so that's how you number your tooth. All the way in the back is called the wisdom tooth. Canine sometimes called the eye tooth. So that's how you name them. All right, so let's see what's next here. Okay, a little bit about cavities. Here's a cavity just inside the enamel. That could get better on its own. If you take good care of your teeth, that might heal. Okay. Now the next spot a cavity can invade into is it can invade into the dentine. Okay, the deeper it invades, the less likely it could ever get better on its own. There's different people on the internet, you know, saying what they think can get better and what can't. But the deeper it goes, the worse this problem gets. All right, so that's why you want to turn your act around. The sooner the better with cavities. The next thing is the cavity going into the pulp space. So it's eroded through the enamel, through the dentine, and now into the pulp space of the roots, of the root canals. And that's not good because it can very quickly infect and destroy the pulp space, infect and destroy all of it, and destroy the nerve. And this isn't going to get better just on its own. This is called a pulpitis, an infection of the pulp space. Okay, then the dental cavity infection can spread down through the pulp space into the jawbone. Okay, mandible on the bottom, maxilla on top. And infection of the bone is an osteomyelitis. It's often called a periapical infection or periodontitis or osteomyelitis, periapical osteomyelitis. That's the name I would think is the most precise in describing. So infection of a bone is osteomyelitis. This is the apex of the root, so this is periapical. Peri means around, so around the apex would be periapical. Okay, periapical, and the way I see it, it will be on a CAT scan. I'll see a lucency right at the apex of the tooth root, and I'll call that a periapical lucency. Dental consult is recommended, okay? And ideally they would extract the tooth and then scrape that out and clean it out, okay? They can do a root canal procedure, but I think a root canal procedure is not a good procedure because it always ends up being infected. We'll discuss that in a future chapter. Okay, here's what it looks like to place an amalgam. A dental amalgam, they call them silver fillings, but in reality they're 50% mercury. That's a lot of mercury, 50% mercury. And it's really like an amalgam or an alloy. There's a little bit of zinc or tin in there. There's a little bit of silver in there. Calling them silver fillings is really a euphemism because mercury is a major brain toxin, one of the most potent neurotoxins known to mankind. It can cause brain damage, and here you are installing it into a tooth where you got veins that drain the brain and the teeth that are bidirectional with no valves. Not a good situation. All right, we'll talk a lot more about amalgams and tooth infections and all this other stuff in the next one. So I hope you found that helpful.